Assalamu alaikum wa rahmatullah. My name is Uhud. Welcome to my FYP1 video presentation to topic of development of temperature and oxygen monitoring device and classification model. This topic is supervised by Dr. Rania. This is the agenda for today's presentation. So due to increasing of getting chronic diseases like diabetes, cardiovascular diseases, this all lead to increase also in chronic wound happen. So all that lead to emphasizing the need of more accessible and efficient method to manage the wound. Wound, there's a lot of type of wound, like diabetic wound, pressure, surgical, burns, and a lot of another types. So, a mobile application for remote wound monitoring devices are convenient for patients and healthcare providers. It give accessibility, personalized healthcare, and diagnosing and monitoring in real time. So remote wound monitoring devices typically consist of sensors attached to the wound and collect data about it, send it to the device or healthcare providers. So if in case of increasing or warmth in wound area, that might be a sign of infection. So if the wound area temperature is above 38, this is a sign of infection, and insufficient oxygen supply is also considered as a sign of infection. So a problem statement of this study is still there is no use for this kind of technology due to lack of professional view, and most of applications for wound monitoring focuses on imaging analysis rather than biomarkers like oxygen temperature and so on, and it will be challenging to develop an accurate measurement as from sensors devices, secure data, and design a friendly user interface. The objective of this study is to develop a wearable temperature and oxygen sensor using Arduino, develop a wound classification model using machine learning, and develop a mobile application to personalize wound monitoring using Android applications. The scope of this study is collecting data from the wound using oxygen and temperature, uh, give it to a machine learning to classify this wound condition. Significance from of my study is it will be cost effectiveness, low cost, also real time feedback from health providers, and better accessibility for health help in any time. One could be classified as from class 1 to 4, clean, contaminated, contaminated, and dirty, and that one is infected and will affect the wound healing. So, about the role of oxygen and temperature in wound, oxygen in general is helps with metabolism in the body. So it helps with synthesis of collagen, also remodeling the damaged blood vessels and control bacterial growth. In case of hypoxia, which is insufficient oxygen supply to the wound, this will lead to delay or chronic wound to happen. Uh, the temperature levels, maintaining the good temperature levels will promote faster and good healing. High temperature might be a sign of infection, and both of these biomarkers are indicates current healing stage of the wound. Biosensors are devices that use to collect data in general about biomarkers, machine learning and wound monitoring devices. Machine learning helps a lot with healthcare. It aids to improve patient self-care, reduce the unnecessary visits to hospital, and increase the accuracy of diagnosis. So machine learning have a lot of types like supervised, unsupervised, and so on. This is my flowchart for this project. Regarding the first objective, to develop a circuit, data collecting circuit, using Arduino Uno and ASB 8266 that want to send data using Wi-Fi, and database to store the data. This is the hardware components and circuit diagram. This is circuit schematic and the flowchart of the circuit schematic and testing. To develop a machine learning model, this is the process need, and to develop mobile application or actually to train that machine learning model and then change it to mobile application. This is the steps need. So need from to change it to Python script, moving so on to JavaScript. This is the compatible way to deal with Android devices. This is my Gantt chart for FYP1 and FYP2. Okay, this is the expected user interface for mobile application, showing the temperature, oxygen, and then wound condition. For now, I have done most of objective one, and this is the result of it. And I'm halfway to my objective two and dealing with machine learning model. In the end, wound care is witnessing significant development in recent years. So, by integrating artificial intelligence, especially machine learning, this will lead to better and greater healthcare for wound. Development as well as smartphone application for wound monitoring will present a huge lab in this field by healthcare, and this technology will empower individuals to take an active role in monitoring their own wound condition. This is some of the references I used, and thank you so much.